So I went through the application process just last year during the 2018-2019 cycle, and I was blown away by how much money went into this process. I was spending so much money on application fees and then also traveling to all the interviews. I've talked to many students who are currently going through the process, and they have many similar concerns about how much money they're spending as well.
That's Dr. Aamir Hussain, and this is Dermatology Weekly, the weekly podcast from MD Edge Dermatology. I'm MD Edge editor Elizabeth Mishkati.
And I'm MD Edge editor Terry Rudd. Today, costs associated with dermatology residency applications average $10,000 per applicant. Dr. Daniel Mazori talks to Dr. Aamir Hussain about ways to reduce costs for applicants, particularly during the interview process, when frequent long-distance travel may be required.
In the news, some atopic dermatitis patients on Dupilumab may develop a paradoxical head and neck erythema distinctive from the disease. And the case of a California woman poisoned by methylmercury in a skin lightening cream obtained from outside the U.S. highlights the risks of these products.
You can reach Dermatology Weekly by emailing us at podcasts@mdedge.com. You'll also find that email address in the podcast description.
And now the news.
Cases of head and neck erythema have been reported in patients with atopic dermatitis treated with Dupilumab, erythema that's clinically and histologically distinct from the patient's background skin disease. The phenomenon was a hot topic at the latest meeting of the European Task Force on Atopic Dermatitis, which was held in conjunction with the annual Congress of the European Academy of Dermatology and Venereology. At the meeting, Dr. Linda de Vys of Erasmus University Medical Center in Rotterdam presented a case series of 7 affected patients, which included histologic examination of lesional skin biopsies. Dr. de Vys says the erythema is different from the classic eczema patients experienced before Dupilumab was initiated. There was minimal or no scaling, itch, or burning sensation. Biopsies were characterized by a perivascular lymphohistiocytic infiltrate, an increase in ectatic capillaries in the papillary dermis, and a notable dearth of spongiosis, eosinophils, and neutrophils. The overall histologic picture was suggestive of a drug-induced skin reaction. One striking finding was that, despite the erythema, the 7 patients still rated their treatment satisfaction as 9 out of a possible 10 points. Dr. de Vys attributed that to Dupilumab's potent efficacy and comparatively acceptable safety profile. The erythema didn't respond to topical corticosteroids, topical tacrolimus, antifungals, antibiotics, emollients, oral steroids, or antihistamines. 2 other clinicians at the meeting also reported de novo head and neck dermatitis in patients on Dupilumab. And there have been a few reports in the literature. A letter to the editor in this month's Journal of the American Academy of Dermatology describes facial redness in 11 patients treated with Dupilumab.
The first known case of skin lightening cream contaminated with methylmercury was recently described in the CDC's Morbidity and Mortality Weekly Report, and the case highlights the particular danger posed by organic mercury compounds. Dr. Anita Mudan of the University of California, San Francisco, and her associates reported the case. The patient was a 47-year-old Mexican-American woman who sought care for dysesthesias and weakness in the upper extremities. That progressed to dysarthria, blurry vision, and unsteady gait over 2 weeks, leading to her hospitalization. Over the next 2 weeks, the patient declined into an agitated delirium. Screening blood and urine tests detected levels of mercury exceeding the upper limit of quantification. The culprit, a skin lightening cream the woman had been using for the past 7 years, which came from Mexico. Typically, contaminated skin lightening creams contain inorganic mercury at levels up to 200,000 parts per million. Analyses of the patient's cream determined that it contained mercury at a lower concentration, 12,000 parts per million. But it contained the organic compound methylmercury iodide. The investigators say the significantly lower mercury content of the cream in this case underscores the far higher toxicity of organic mercury compounds. The California Department of Health is warning the public about the health risk, and it's screening other skin lightening cream samples for mercury. Despite treatment, the authors wrote that the patient is unable to verbalize or care for herself and requires tube feeding. We'll be right back after this message.
And now, Dr. Daniel Mazori and Dr. Aamir Hussain.
Today we're talking to Dr. Aamir Hussain, who wrote an article about the cost of applying to dermatology residency for the December 2019 issue of Cutis. Dr. Hussain is a preliminary medicine intern at Northwell Health in New York and will be a dermatology resident at Georgetown beginning in July 2020. Thank you for joining me today, Dr. Hussain.
Thanks. Happy to be here.
So what inspired you to write an article about the cost of applying to dermatology residency?
So I went through the application process just last year during the 2018-2019 cycle, and I was blown away by how much money went into this process. I was spending so much money on application fees and then also traveling to all the interviews. So I decided to do some quick research on how much the average student spends, and I found the average cost was about $10,000 per dermatology applicant, which I thought was astronomical. So I was just wondering if there are any ways we could reduce this burden on applicants.
Yeah, and it's a subject that's very timely given that we're in December, and December and January are peak months for dermatology residency applications. So I think it's something that's important to be talking about right now.
I've talked to many students who are currently going through the process, and they have many similar concerns about how much money they're spending as well.
So one of the things that I thought was interesting about your article is that it mentioned how otolaryngology has considered various changes to their application process based on applicants' feedback. What are some of these changes?
Yeah, so otolaryngology, or ENT, has gone through various changes in the past several years in an effort to decrease the number of applications people send out. So at one point, they tried to add a unique supplement to every single application, and they thought that this would decrease the number of applications, but students just filled out all the supplements and applied broadly anyway. So they started suggesting other ideas, one of them being a hard cap on the number of applications that each person can send. And this actually polled relatively well. About 2/3 of students in a survey agreed to these caps because they admitted that they were applying to programs they had no real interest in, but they just wanted to maximize their chance of matching in a very competitive specialty.
You similarly suggested in your article that one solution to make it more affordable to apply to dermatology residency would be to cap the number of applications. What do you think is a reasonable number for dermatology, and how do you think that dermatology applicants would feel about a cap? Do you think that they would feel similarly to ENT applicants or maybe feel differently?
Based on the Apply Smart data that's put out there by the AAMC, it's around 50 to 60 applications. After that point, there seem to be diminishing returns in the number of interviews you're getting for every application you send out in addition to that. So potentially around 50 or 60 might be a reasonable cap. Maybe you can make exceptions if people are couples matching or foreign graduates. There could be some wiggle room there. So far, I've talked to a few applicants or people who have matched recently, and they feel this is a reasonable change because right now we're in this lose-lose situation where applicants feel like they need to apply to every single program to maximize their chances, and program directors are overwhelmed by hundreds of applications for one or two spots, and they start using arbitrary metrics like step one scores or grades to weed out students without realizing which students have a true interest in their program or not. So a hard cap on applications might break this cycle.
Yeah, I think it could also make applicants be, really conscientious when they're applying in the beginning and think long and hard about programs that are a good fit for them, geographically or otherwise, and go from there as opposed to, like you said, just painting with a broad stroke and seeing what hits.
Yeah, right now I've also noticed that there seems to be like an inefficient allocation. So, for example, there are programs that I accepted an interview offer at that I did not really want to go to. And there are places that I would have liked to get an interview that I did not get one. So if programs had a better sense of which places students were more likely to rank or attend, there would be a better allocation of these interviews. It's such a limited resource.
Yeah, I think it's something interesting to consider also when I think back to my application process. In terms of the places where I interviewed, there were some that I never expected to get interviews from, just based on where the programs are geographically, or other biases that I expected. So, when I look back and think about how I would have picked the programs I would have applied to had there been a cap, I don't know if the ones where I did get interviews would have made the list within that cap. So it's sort of an interesting thing to think about in retrospect. But I certainly agree that it forces the applicant to be more considerate. And, I think that both the applicants and probably the programs too would benefit from that.
Yeah, if I have a limit of only, say, 50 applications and I send it to a program, that program knows that I really value that place and I would be very likely to attend the interview and rank the program. So I think it would be beneficial for programs as well to have this, and they have fewer applications to sort through.
Similar to a cap, or along the same lines, some of the other changes that I was reading about ENT considering was the idea of a flag. So in addition to, say, capping the number of applications that you could submit, you could also pick a couple that you were especially interested in, kind of, highlighting that interest to the program, letting them know that you were super interested in them. And, that's another metric per se that a program could use to go through applications I thought was interesting.
Yeah, I think that could definitely work. I think in dermatology, the way that people have been trying to do that is writing a separate personal statement for programs that they have a strong interest in, or reaching out to them independently. But I think this would be a nice way to formalize that process.
And the other thing that I thought was interesting from the ENT perspective was the idea of a wave, where you can sort of apply to, say, 20 programs during the first wave and then wait to hear back in terms of how many interviews you got from them. And then based on that, decide to apply to another 20, for example, in a second wave, and so on and so forth. But if you were satisfied with the number that you got during the first wave, then you were done at that point. I think it's a little bit complicated in terms of implementing that with ERAS, but it was certainly an interesting concept to read about.
Yeah, actually, I'd never considered that as an option, but I'm sure it would be interesting to try it out.
The other solution that you proposed in your article was regional interview coordination. Can you talk a little bit about how this might work and if you foresee any issues with implementing a system like this?
Yeah, so this would be basically all the programs in a big region of the country that has multiple dermatology programs in a small geographic area could arrange to either do all their interviews on the same day or within a few days of each other. So, for example, New York has, I think, 6 or 7 programs in a near geographic radius. So they could book out 2 or 3 days, and students who get interviews at any of those programs could just come for those 2 or 3 days and see all the programs at the same time. So this would cut down on travel costs, which for applicants are one of the biggest drivers of the overall fees, because you're booking flights on short notice, and round-trip flights across the country are very expensive, hotels, all these other things. And I know a couple specialties have tried this, where they basically book out a hotel conference center, and they have program directors in each room, and you rotate among each of those programs. So the downside of this is that you don't get to see the individual facility or the place that you're working. But in reality, the facilities are relatively similar, and people don't really make decisions based on these cosmetic things. They really want to get a sense of the people at the program. So I think this regional coordination would solve a lot of those problems and not really have that many drawbacks.
Yeah, that's really interesting. It kind of reminds me of what I've heard friends of mine in other industries go through, like law or finance, where, for their internships or jobs, they all convene in one city and, just kind of go through different rooms, interviewing with different firms and doing that sort of thing. So whether you did that sort of on a national scale where everyone met in one city, or, sort of just more regionally where every program in one city met at some central hotel or conference area and then did what you described, is certainly very interesting. I looked out in terms of my California interviews. They all just happened to be one after another, and I don't think on purpose, but just because of the way that I was able to schedule them. So if there was certainly a way to do that in a more deliberate sense, I think that would certainly help applicants a lot.
Yeah, I think the real problem with this approach is that it requires a lot of coordination and buy-in from programs. And unfortunately, I think some programs actually value this fragmented approach, especially when applicants have conflicting interviews on the same day. They have to make a choice on which one they want to go to. And some programs use that as a way to filter out applicants. So it would take a lot of collaboration among programs, which I'm not sure that programs would be willing to do.
I think another interesting way to potentially decrease travel costs in a very dramatic way is videoconference, and this is something that you mentioned the possibility of in your article. Do you think that video interviews would ever be able to replace in-person interviews in dermatology, or do you think that in-person interviews are always going to be the standard?
So I think in general, in-person interviews are the ideal. So, and when we meet people in life, it's always better to have like a direct interaction. I think due to practicality concerns, it's not always possible. I went to one program that actually tried video interviews and then compared the data for them versus in-person interviews. They found that people in video interviews were consistently rated lower. So it seems that it's possibly due to the fact that it's over technology and not in person. So I think if they did implement it, it would have to be standardized. So you would have to have every applicant do video interviews. Because if you have this dual situation, you might run the risk of people who aren't able to fly out that might convey a signal that maybe they're not that interested.
Yeah, that's very interesting and important to consider. I wonder if society becomes more technological, even the practice of dermatology trends more towards telederm, then maybe that will help with the acceptance of tele-interviews. But I can certainly see how these days, we practice medicine in person and we're just used to interacting like that with not only patients, but our colleagues and other people in our lives. So I can certainly see why, at least for the time being, in-person interviews are going to be the standard unless, like you said, a program decides to do all their interviews via video conference and therefore even the playing field among all applicants that way.
Yeah, I know emergency medicine tried a standardized video interview in the past few cycles, and there was kind of a mixed reception to that because it felt like students did not really gain much from that experience. They tended to ask pretty standard questions that you just recorded an answer to. So I'm not sure if dermatology would want to follow suit on that. I think there could be a hybrid where you maybe have some standard questions and then some kind of organic ones that come up during the interview.
Something else that I've seen and heard of programs doing is interviewing applicants during their away rotation, so they know that they're already there and, they seem like someone who they would interview anyway. If they're traveling from afar, they'll offer them an interview while they're already there. I think I've heard overall it maybe isn't as ideal as coming in on the actual interview day, similar to doing, say, a video conference. You're interviewing in a different way than the standard interview, which is a formal day, but that's something that I've heard of as an alternative if someone really feels like travel would be an issue that some programs do and is something to think about.
Yeah, I agree. I think when you interview on an away rotation, it's a little bit more informal because you've been working with the faculty for how many weeks and you already know everybody there. So it might feel more like a casual conversation than a formal interview. That's also why I think the regional coordination is a good solution, is that it's standardized for everybody. So even if you're like a home applicant at that school, you're still going to like a neutral ground. So you're on the same field as everybody else.
Yeah, and I think it's important to a large extent to be interviewing at the same time as everyone so that, the impression you make is as fresh as the impression as other people. When you interview doing an array rotation, that may be months before everyone else. And, even if you're stellar, you may just sort of be somewhat forgotten because of that. And, you may not have the chance to, say, meet everyone that you would otherwise meet. And, depending on what other activities the program has to offer during their interview day, you may also just miss out on, opportunities to learn more and see things that could help you in terms of your decision and seeing if you're a good fit and how you want to rank that program. So definitely something to think about, but a good option if you can't, make the real interview day. Is there anything else you'd like to share with our listeners?
Actually, yes. I wanted to ask you a question. Since you've had more experience on the selection side of the application process, I was wondering how feasible you think some of these solutions might be.
So I agree with you that the idea of regional interview coordination is probably the most logistically challenging, even though I think that has the most bang for one's buck. I think I can see that having the most issues in terms of implementing. So I'm sort of intrigued by the idea of a cap. I think that, that's something that could very easily be put into effect. And, it's like I was saying earlier, put myself in the shoes of an applicant with a cap and know how I'd feel. But it's interesting from what you were saying, from your experiences, that most people would be receptive to that. So I think whether you implemented a hard cap or a cap in a wave-like fashion where you sort of applied and got a certain number of interviews and then applied to more programs, I think that would be really interesting to see how that would do. And I think the idea of video interviews is also really interesting. I think beyond regional interview coordination, if we could transition to a completely video interview-based process, that would be the most cost-saving measure of them all. And I think that if a program felt comfortable doing that, either for all of its interviews or say maybe for like the first pass of interviews, and then followed up with, a more limited number of applicants for a second round of interviews that were done in person based on, how applicants did during kind of an initial video interview process, then that's something, that would be more time consuming but cost saving. So I think if there's, some kind of way to implement that, I think that would be the most interesting and help applicants the most. I think that's probably the way it's going to be at some point in the future. Like I was saying with Telederm, that's something that is still developing, but I think in a couple of years that's going to be very much a norm. And so I think as we, as practitioners, evolve into practicing dermatology online, then I think that we'll feel more comfortable interviewing applicants that way too. So I don't know in how many years, but sometime in the future, I think maybe that will be the way things go. So thank you again for joining me today, Dr. Hussain. For more on the subject, check out Dr. Hussain's article in the December 2019 issue of Cutis.
And that concludes this week's episode of Dermatology Weekly. To get past and future episodes of Dermatology Weekly, subscribe now on Apple Podcasts, Google Podcasts, Spotify, YouTube, or wherever you get your podcasts. I'm Terry Rudd.
For Dr. Vincent DeLeo, MD Edge editor Melissa Sears, and all of us here at MD Edge, I'm Elizabeth Mishkati. Thanks for listening.